Day after day, these paramedics are racing across Kampala, answering the calls of increasingly desperate families. This time, it's a patient who needs to be transferred to a different hospital as her condition rapidly deteriorates. Most Ugandans can't afford a private ambulance like this one, but now they're calling anyway, as public services are saturated. This woman has been admitted to 4 hospitals in 2 weeks. The first 2 didn't have enough oxygen. Now they're taking her to ICU. Her family has spent the equivalent of £10,000 in 2 weeks to keep her alive. And the bills keep coming.
We called contacts in the public hospitals, but we were told they are full. So we had no option in the public hospitals. That's why we went private. It is stressful, it is financially draining to the patient, to us the family members. I don't know what to say.
Official daily COVID cases multiplied by 10 in the space of 2 weeks between May and June. The country is now facing an oxygen crisis, and with around 200 public ICU beds for a population of more than 44 million, staff and resources are being pushed to the limit.
It's been a nightmare. There were no beds in public facilities, no beds in private facilities. We had 3 patients we had to ventilate and be in the ambulance for almost 9 to 10 hours because we're fighting to find an ICU bed. I've never seen anything like that before.
The most urgent need here is for vaccines, but they're just not coming fast enough. The Ugandan government has received just over 1 million doses so far, for a target population of 22 million people.
The Ugandan government was widely praised for its rapid reaction to the first wave of COVID-19. They locked down hard and fast here and communicated prevention measures quickly and effectively. But this new wave is spreading at a breathtaking pace, and now the authorities are struggling just to keep up.
Despite persistent allegations of corruption, ministry officials say they're doing their best to support health workers on the front line.
We have been, of course, supporting them at their workplace, provide PPEs, provide risk allowances.
There are still reports of healthcare workers saying they've not received their salaries, or they've been delayed, or they've not received their risk allowances, or some are even saying they're working with inadequate PPE. I mean, are they really expected to continue working under such circumstances?
Our resources, I don't know, for some reason, we're not able to raise all the money to go. But we're able to get the money and pay them. All the funds that they provided to us was fully accounted. What we see in the media, by the way, I don't know why people decide to trade lies in the media. We don't know.
But despite assurances from the ministry, medics in the public service are still saying they haven't been paid, and patients are directly affected. One doctor agreed to speak on condition of anonymity, fearing repercussions for speaking out about his working conditions.
The last time I was personally paid was December 2020. For most of the people who work in the big government hospitals, it's unavoidable. You have to have something you're doing on the side, and of course that has an impact on their ability to deliver a service. They work diligently in the private sector. I mean, they're motivated and equipment is available. They're willing to work. But when they come to government, they just slip off. They're not motivated.
To ease pressure on hospitals, a limited lockdown is in place, putting huge financial pressure on all but the wealthiest. With vaccines arriving at a trickle, this solution isn't sustainable for long. Another urgent call, another COVID patient, another race for an ICU bed. And somewhere in Kampala, another family, desperately hoping for the best.
Gordon Harrington reporting. As we came on air tonight, we learnt the sad news that the patient who you saw at the beginning of that report passed away today.